I should be talking about a very important nerve of the upper limb, and this is in the name of radial nerve. Okay, radial nerve. This is the MBBS Niger. Do subscribe to our YouTube channel and follow us on Facebook. So, the radial nerve. This is a radial nerve. I could see the radial nerve is in the radial groove. If you're coming from our lectures on the humerus, you know that like the mid posterior shaft of the humerus has the radial groove, okay, which we said that the radial nerve is actually the nerve that lies there, okay. So the radial nerve is a branch of the posterior cord of the brachial plexus, a branch of the posterior cord of the brachial plexus, okay. Um, it enters the posterior compartment of the arm with or accompanied by the profunda brachial artery between the long and the medial heads of the triceps. Okay, so it descends in front of the lateral condyle of the lateral epicondyle of the humerus and divides into terminal branches. Okay, these terminal branches, we get to see that we have the superficial terminal branch and we have the deep terminal branch, also known as the posterior interosseous nerve. Okay, I have separate videos on this already. Now we say that the terminal branches are the superficial branch and the deep branch, which is also known as the posterior interosseous nerve. Okay, so damage to the main trunk of the radial nerve results in wrist drop. I already made a video on wrist drop. That's maybe you pressed this area of your armpit against a chair, all right, maybe you get drunk, then the hand is wrongly placed and your radial nerve can be damaged. Okay, it will result in wrist drop. Your hand will be like this, all right, it will drop. Okay, wrist drop or Saturday night palsy. Okay, and this is due to the paralysis of all wrist extensors. All right, so this is the radial nerve and its distribution, but we'll come back to this, okay, after the last slide. So the radial nerve, which is of the origin from C5, C6, C7, C8, and C1, is a nerve of the extensor compartment of the arm and the forearm. Okay, the radial nerve winds around the back of the humerus in the spiral groove, okay, accompanied by the profunda brachial artery. Okay, then characteristically, the branches of the radial nerve tends to arise above their destination. Okay, so this is radial nerve. Let's talk. We said that is a nerve of the posterior compartment of the arm and the forearm. Let's talk about the muscles of the posterior compartment. Most of the muscle has the extensor name attached to it. All right, so we have the extensor carpi radialis longus, we have the extensor carpi radialis brevis, we have the extensor carpi ulnaris, we have the extensor digitorum muscle, we have the extensor digiti minimi muscle, we have the extensor indicis muscle, we have the extensor pollicis longus muscle, we have the abductor pollicis longus muscle, we have the extensor pollicis brevis muscle. Okay, so these are all the muscles of the posterior compartment of the arm, and they are supplied by the radial nerve, okay, but not by the radial nerve directly. You know that the radial nerve has a main trunk, the radial nerve has a superficial branch, and the radial nerve has a deep branch. Okay, so for the specific supplies of this nerve, I'll be making another video on it. All right, so see you guys in the next tutorial, and bye for now.